Hi, I am Dr. Arsalan and today we are going to study the difference between cortical nephrons and juxtamedullary nephrons. These are basically two kinds of nephrons. The cortical nephrons, these lie in the cortex of kidneys. So the nephrons which are lying in the cortex of kidneys are called cortical nephrons, and the nephrons which lie on the junction of cortex and medulla of kidney are called juxtamedullary nephrons. Juxta means junction. So their bovine capsule is at the junction of cortex and medulla, while their loop of Henle is extending to the renal medulla. So the first difference between the cortical nephrons and juxtamedullary is their location. Second difference is their abundance. The cortical nephrons are most abundant. These are about 85% in the kidneys contain cortical nephrons, while there are only 15% juxtamedullary nephrons. Third is their function. The cortical nephrons, these are working or operating in normal ordinary conditions and they produce the dilute urine. While juxtamedullary nephrons, these are operational in the state of dehydration. In case of dehydration, the juxtamedullary nephrons are operating and these reabsorb more and more water producing concentrated urine. So the urine production due to cortical nephron is dilute urine and juxtamedullary produced concentrated urine. So the next difference between cortical and juxtamedullary nephron is the cortical nephrons have short loop of Henle, while juxtamedullary nephrons have long loop of Henle. And we know that in loop of Henle there is a mechanism called counter current multiplier mechanism. The counter current multiplier mechanism must be remembered, and this is the main difference which creates between the juxtamedullary nephron and cortical nephron functioning. Counter current multiplier mechanism means when the body is in need of water or the body is in dehydrated condition, then the loop of Henle of this nephron secretes out sodium and chloride ions actively by using the body energy. The loop of Henle secrete out the sodium and chloride ion from the glomerular filtrate. Filtrate left behind in the lumen of loop of Henle becomes diluted due to loss of these salts. This filtrate, when gets diluted, has high concentration of water in it. So water concentration increases in the loop of Henle, then outside state where the water concentration is decreased as compared to the loop of Henle. Due to this concentration difference or concentration gradient, the water of loop of Henle transported by the process of diffusion or osmosis into the blood or kidney. So this transfer or shift of water from the loop of Henle into the kidney or blood is called counter current multiplier mechanism. Most of the water is reabsorbed from this loop of Henle in this mechanism. So due to long loop of Henle, the counter current multiplier mechanism is activated and it absorbs more and more water by the process of osmosis due to concentration gradient created due to loss of salts. So this is basic theme of juxtamedullary nephrons functioning. Sixth function of cortical nephrons, peritubular capillaries. The capillaries, as we know that the afferent arterioles come into the Bowman's capsule and form a tuft of capillaries called glomerulus, leaving the glomerulus by efferent arteriole. This efferent arteriole then coils and recoils around the tubules of the nephron, renal tubules. This is called peritubular capillaries. And when these peritubular capillaries wrap around the loop of Henle, this is called vasa recta. This vasa recta then drains into the renal vein. So in case of cortical nephrons having short loop of Henle, these peritubular capillaries wrap around the proximal convoluted tubule and distal convoluted tubule, while in case of juxtamedullary nephron, they have long or large loop of Henle. So these peritubular capillaries in the form of vasa recta wrap around the loop of Henle. So the difference between cortical nephrons and juxtamedullary nephrons primarily based upon the size of loop of Henle, because due to the size of loop of Henle, the function of the nephron is totally altered. In cortical nephron, due to small loop of Henle, they cannot retain water, they cannot reabsorb water into the body, while in juxtamedullary nephrons, they have large loop of Henle. They can reabsorb more and more water from the urine, from the glomerular filtrate into the blood, and can sustain the body in hydrated condition.